Director of Ending Homelessness and Poverty at United Way of King County. And I'm a really proud member of Healthpoint's Healthy Together campaign task force. And I'm honored to be here tonight moderating this event. Those of you at home can join our conversation by putting your question in the question box anytime during the evening, and we'll look at those in the second half of the program. As we come together tonight, our country faces unprecedented challenges, including COVID-19, the struggle for racial justice, and political uncertainty. Tonight, I hope you'll have an inspirational evening about what works for our most vulnerable neighbors and how compassionate solutions can heal local communities. Our program tonight is a rare opportunity to join a master of his craft in conversation with a remarkable subject of his work in progress. Let me tell you a little bit more about our guests. Tracy Kidder is widely regarded as a master of narrative nonfiction. Tracy launched his exceptional career with The Soul of a New Machine, which won the National Book Award and the Pulitzer Prize. Kidder has enjoyed enormous success with Mountain Beyond Mountains and Strength in What Remains. Mountains, which is one of my personal favorites, is about a characteristic humanitarian, Dr. Paul Farmer, in his efforts to address the global health crisis of AIDS and tuberculosis through his NGO Partners in Health. Kidder's other books include House, Among Schoolchildren, Old Friends, and Hometown. Dr. James O'Connell, who I've just had the pleasure of meeting, is the president and founding physician of the Boston Healthcare for the Homeless program, which serves over 12,000 people experiencing homelessness each year in 2 hospital-based clinics and more than 60 shelters and outreach sites all across Boston. With his colleagues, Dr. O'Connell established the nation's first medical respite program for people experiencing homelessness in 1985. His first book, Stories from the Shadows, Reflections of a Street Doctor, was published in 2015. He's received numerous awards, and in addition to his role at the Healthcare for the Homeless program, he's an assistant professor at the Harvard Medical School. Before we get into conversation with Mr. Kidder and Dr. O'Connell, we'd like to share a message from Healthpoint's president and CEO, Lisa Yohalam, and Healthpoint board chair, Lawrence DeShields.
Good evening. I'm Lisa Yohalam, Healthpoint's president and CEO.
Good evening. I'm Lawrence DeShields, chair of Healthpoint's board of directors.
Normally, we would be gathered in a lovely hotel to celebrate our patients and the great work of our staff and our partner organizations in creating a healthy community. We can't be together in person this year, but we still wanted to connect and spend some time together thinking about the importance of health, especially now, and the importance of access to quality healthcare for everyone in our community.
Many of you are familiar with Healthpoint, but for those of you hearing about us for the first time, Healthpoint is a community health center organization with 18 sites throughout South and Northeast King County. Healthpoint's mission is to strengthen communities and improve people's health by delivering quality health care, breaking down barriers, and providing access to all. Our health centers provide whole person care that includes medical, behavioral health, dental, pharmacy, and other services and programs to everyone, regardless of their circumstances. We are the healthcare home for over 100,000 people in King County.
2020 has provided great challenges for all of us. At Healthpoint, we continue to rise to those challenges and have transformed the way we care for our patients and our community in response to the COVID-19 pandemic. As Lawrence mentioned, our mission includes breaking down barriers to care, and sometimes that means bringing care to the patient. Healthpoint's community outreach team of nurses, social workers, and resource specialists reach out to families and individuals experiencing homelessness in shelters, in supportive housing programs, in encampments, and other community locations to provide them with compassionate medical care, behavioral health, and assistance with their social needs. Which brings us to the theme of tonight's event, We are honored to host author Tracy Kidder and Dr. James O'Connell in conversation about the lessons learned from Boston's Healthcare for the Homeless program. Thank you both for making time to join us to discuss this important topic.
I am so proud of the work that Healthpoint is doing to care for our community. Every day, they're working to make sure people have excellent care when and where they need it. And those of us that are in the Seattle-King County region know that homelessness is a growing crisis, and making sure that our homeless neighbors have access to health care is something that is so critical and something that Healthpoint works on each and every day. So I'm so excited for this conversation and to hear a little bit more about the work that's been happening in Boston for decades and the story of how that's all come together. Please join me in welcoming Dr. O'Connell and Mr. Kidder. I hope you both are having a wonderful evening and taking care in these really, really challenging times. So I want to start off, how does a doctor and a famous Pulitzer Prize-winning author, how do you two meet?
I was doing research for a book about somebody else, and who had an interest in homelessness, and we went out on what's called the outreach van from the Pine Street Inn. Jim still rides once a week, I think. Yeah, he used to ride a lot more often. But anyway, I was quite astonished. I had no idea. I can't really quite explain. It just was amazing to me to see this world of rough sleepers, the homeless people who choose not to go to shelters, who insist on living outside. And I don't know, it was just fascinating. And their response to this guy they called Dr. Jim was pretty moving to me. So it's interesting.
Dr. Jim, how did you end up in this spot? How did you begin working with people experiencing homelessness?
Entirely by accident, Lauren. I was what my mother used to call the delayed vocation. So I didn't get to medical school till I was 30. And when I was finishing up my residency, my plan was to become an oncologist and go do a fellowship. And the city of Boston just happened. This was 1984, 85. And the problem of homelessness, this sort of modern one that we all know so well, was just beginning to rise in the early 1980s. And there was a grant given to the city of Boston by the Robert Wood Johnson Foundation, along with 18 other cities around the country. And so I got called into my chief of medicine's office one afternoon, and he had been involved with the city in trying to set up the program. But the homeless people that had also been the stakeholders in this demanded a full-time doctor, and they couldn't find one. So I basically got conscripted. He delayed my fellowship for a couple of years, and I thought I'd do a year of urban Peace Corps. And there it was. So I had this was serendipity at its best.
That's incredible to hear, and clearly has become a lifelong passion of yours. Tracy, what was it about Jim that just made you want to tell his story?
It wasn't so much Jim, frankly. At first, it was the response to him. I was so intrigued that I asked him if I could go out with him again alone, without all these other people. And I remember we came to a loading dock in South Boston. And it was one of those neighborhoods that is said to be in transition. That is, gentrifying. So you had a fancy new condo on one side, and on the other, this disused loading dock with a pile of gray blankets on it. It would have just looked like a pile of blankets to most people, but the van stopped, and the drivers and Jim went over. I sort of followed along, and the drivers started talking to the blankets, and a voice came back asking them in rather impolite terms to go away. And then Jim said, "Let me try." And he went over and said, "Hey, so-and-so, I haven't seen you in a long time. I'm worried about, I just want to make sure you're okay." And this hit, there was this volcano, this eruption in the blankets, and this face came up, hair sticking up, and bright red face, and he said, "Dr. Jim, how are you?" So I just thought, this is interesting. He's it's a really interesting patient panel, and you know, I think it's a very interesting profession and a kind of wonderful one too. I'm interested in people who are trying to improve the world. You know,
that's incredible, and clearly the stories that you have told have ranged right from these everyday people to folks that have become real heroes. And Jim, really, for people experiencing homelessness, that's what you are. What has kept you doing this for so long? What inspires you every day?
You know, there's an interesting sort of joy in doing this work. And if you ask around, most of the people, I'm sure the ones in Seattle doing it at Healthpoint, but there's something about taking care of people whose stories are so diverse, so rich, and who have had so little given to them in life that when you get involved in that, it's really hard not to get into it. I used to think, I remember when I thought I was going to do this for a year, I thought it was my year of doing good, giving back, all the stuff that I, was trying to solve my late 60s conscience with. But what I realized is that, as you're trying to do good medical care, and in my case, I was the doctor, I was trying to do good medical care. And I started to realize as I got to know people more and more that they started to tell me what was going on in their lives, and it was mind-blowing. And I realized for most of the folks in our program, the longer you get to know people and the more continuity you have, the more chance you have to be part of their lives, it becomes really hard not to feel privileged and have some joy. Counter to that, though, which I'm sure Tracy will talk about, is it's also hard to tell what success is, because we haven't done such a great job. I was thinking in 36 years that I've been doing this now, homelessness is arguably worse rather than better. So there's this other black cloud that you have to learn to live with, I think, and that can be discouraging. But not the day-to-day interaction. The day-to-day interaction, I think, is quite surprisingly joyful, and it defies routine. Each day has a whole new flavor to it. And I used to think that my life was primarily running away from boredom, and this was a great place to be.
That's incredible, Tracy. As you worked with Jim and went out on some of these rides to visit where people experiencing homelessness were living, what surprised you the most?
I guess it's that diversity. It's a combination of things that I learned from Jim and some of the other people on his team and in the program, and the reality of these people's lives. I mean, I concentrated on what are called the rough sleepers. They're in Boston has probably I think the smallest percentage of any major American city of homeless people who are unsheltered, which, using the British term, we call rough sleepers. They're a very diverse group, and they're very interesting. And I think Jim had the same experience, and I think he warned me that they seem like hardy survivors, and they are resourceful. They all have problems. But they're not hardy survivors. And what surprised me the most in some ways was the shock of realizing that they are by far the most vulnerable people in Boston. If you just look at death rates, I know that there are people in other poor parts of town who are housed who also have alarming death rates, but the death rates of these rough sleepers, the patients that Jim, particularly toward the end of his career, has been focusing on, if I'm right about that, Jim, they die at very young ages, and the thing about it is it's heartbreaking because these are really interesting people. They are people,
They absolutely they are, and by contrast to Boston being one of the smallest unsheltered populations, Seattle actually has one of the largest. So we have over 5,000 individuals who are unsheltered in our region every single night.
Wow.
Jim, tell me a little bit about an experience that you've had with somebody who's unsheltered. And so often there's a resistance to getting services. How have you broken through? What have you done to keep people engaged?
The secret of this is for sure, how do you win somebody's trust, and how do you let them know you're there to help, not there to take away or to tell them what to do. And I have to be honest, there were two things that happened for me, and both are longer stories than I can tell. But when I first got to the shelter, I trained at Mass General. I was coming right out of the ICU, where I thought I was God's gift to medicine, after all that training. And I walked into a shelter clinic, and there was this group of nurses to this day, have been my heroes. And they were it was a 700-bed shelter. It still is. It's Pine Street Inn. And they had a clinic there that they had been running as volunteer nurses, and they would soak the feet of the men. And this was on the men's side. And I remember walking into the clinic, and all these men were sitting around, these crusty, tough guys from the street, and having their feet soaked by the nurses. And when I walked in, the nurse, Barbara McGinnis was the name of the nurse that I grew to love and admire. She explained to me that doctors hadn't been trained very well for this kind of stuff. And she made me soak feet for a couple months, and took away all my stethoscopes and doctor stuff. And my job was to really just get to know people. And it was like a miracle, like soaking feet is a long way from somebody's personal space. I wasn't with my stethoscope right up in somebody's personal space. And it was a real service. You could argue there was some biblical symbolism to it, but I think the nurses pushed that aside. But people who had been walking around all day and were exhausted just really appreciated the service. And I realized after time, after just doing that for over time, and then getting on the van where we served soup and sandwiches and blankets and stuff, it was the slow letting people know we were there to stay and there to help. And once that happened, as the nurses predicted, once you had that trust, then all things were possible. Prior to that, people would never come in.
That's beautiful. One of the things that Healthpoint really focuses on is providing the whole spectrum of healthcare, mental health, dental services, primary care, and especially right now during the COVID-19 pandemic, they're doing a lot of basic needs work, providing food and helping make sure that folks have those essentials. Tell me about healthcare for the homeless, and what are the range of services that are offered?
First of all, I should say I've been learning a lot about Healthpoint, and Healthpoint does some totally amazing stuff. And I would love to get to Seattle sometime and see some of the stuff they're doing, including the holistic medicine that they do, which we do not do very much of. But in Boston, our program tries hard to integrate medical and psychiatric and substance use care, and do it in teams so that each homeless person has a home of some kind where they know they're clinicians. But we've had to respond to lots and lots of different things. And so probably like Healthpoint, we're, by the way, also an FQHC now. So we sort of are managed a little bit the same way I've learned as Healthpoint is. But we do the same. We have a lot of medical clinics. We have clinics in just about every major shelter in Boston, both the adult and family shelters, as well as also there's a shelter for runaway adolescents and kids. And we do that. And then we have a respite program, which is 104 beds for people coming out of the hospital who really are too sick to be in the shelters or on the streets, but have no place to go. And that's another long story in itself. And then we've got many different aspects now. We have a dental clinic that's really pretty crazy active, just like you do. We have the pharmacy, just like you do. All of which, by the way, with homeless people becomes critical, because most homeless people just never get a chance to go to the dentist, and getting them their medications through pharmacy is always difficult. So removing those obstacles has been a real mine. But we've got some other interesting things. We have about 15 years ago, we have homeless people on our board of directors, much as the community health centers have community people on. And one of our board members is a trans woman, and we started a transgender clinic, but I'm guessing now that must be 10 or 15 years ago. And I remember we had to do it isolated on a Thursday night, close the building down, and did it there so people wouldn't be stigmatized. And, within a few years, it was just part of the mainstream clinic stuff, and we all felt good about that. We've had to respond a lot to the opioid epidemic.
Sure.
And so we have probably similar service to what you have. And then, our street, the clinical work that I get involved in is the street team where we go out at nighttime and during the day to try to get the real hardcore folks who, even though there is a shelter bed for them if they want one, for a whole host of reasons, they don't come in. So that part of the program is to reach out to that part of the program. We've done all the stuff you do, hepatitis C care, HIV care, the things that I think we've learned mostly from other health centers and from working closely with the hospitals. So we've been blessed to live in a world in between those two things.
Well, that's incredible. Tracy, there's so much happening, right, that Jim is working on. Tell us a little bit about how you are putting this story together in this book. What does that look like, your partnership between each other?
Well, it's not exactly a partnership. Poor Jim. He's my late editor. He's the latest of what my late editor used to call.
I was thinking about that word too, Tracy.
I chose to focus on that one piece of this really large and diverse organization, which is the street team. A few hundred people at any given time, and you get attached to them. Everybody has a favorite. As Jim said, one of the great things about a team is that there's always bound to be a patient one person doesn't like, but another person does like. So you have a team to cover all of that. And I've tried to get a taste of all of the organization. They've been very open to me. I've managed to sit in on meetings, and just a few things that strike me as pretty interesting. They've had a very hard time recruiting, and no success. Jim has had recruiting African-American doctors because they have so many options elsewhere. But the organization is extremely diverse in every other way, with plenty of African-Americans and Asians. And I also feel, I remember sitting in a senior management meeting and just doing the numbers, and it was something like 4/5 women, and or maybe more, and they were of all races and so on. The really surprising thing to me, though, is that I've hung around organizations and written about them, and I'm sure that I have missed some of this, but I've never heard anybody yell at anybody else there. I mean, I've heard patients yell, but I've never heard any of the staff yelling at each other. Wow. I don't know if that's because it's such a feminine organization, or not, but it's pretty nice. I'm sure that there are people, I'm sure these are human beings, but it just is one of the nicer places to be. And I think it's partly because I suspect that most of the people who work there want to be there. They're not getting the kinds of benefits they would get if they worked at Mass General or the Brigham, and all of them would be capable of getting those kinds of jobs. So as an organization, it's pretty neat. And McInnes House is astonishing to me. It's what we need, I think, for so many people. And even if you have people housed, you need a McInnes House, I think. But I'm talking too much.
It's amazing. I love. I mean, you clearly have seen this incredible work that this team is doing. Jim, is it true no one yells at each other at your shop?
Never. Absolutely.
Never. We might need a whole story on that.
But Tracy.
Well, in fact, I have a story about Jim once yelling, but he never except once in a while.
It actually is a great place to work, and we're surrounded by lots of, as you can imagine, I'm sure Healthpoint's the same way. It's wonderful people, really dedicated, and mostly really humble and fun, so it's good.
I'm curious how the COVID-19 pandemic has impacted the work that you're doing, Jim, and then also just the process of writing a book, Tracy.
Well, it hasn't impacted me much. I mean, although I haven't been, there are times when I've wanted to go to Boston to do research. Unfortunately, I'm old. I'm in my 70s, and I also take a drug that that weakens my immune system. So I've been pretty much ordered by my daughter to stay home. But
the daughter is right.
Stay in this office and write, So it hasn't affected me much.
How about you, Jim?
Well, from a programmatic point of view, and in talking a little bit to Lisa before, I suspect we have done the same somersaults and topsy-turvy stuff to try to respond to COVID that Healthpoint and other organizations have done. But, we had to, as we realized this was coming our way, whether we liked it or not, it emphasized for us once again, which you all know, how the very vulnerable and excluded populations are really at risk when these things come our way. And so when we were thinking of the main, to cope with the coronavirus, we were going to have to isolate people, quarantine people, make sure we could do contact tracing, and then treat them, do all that. And our program at that time was just busy, bursting at the seams, as I'm sure Healthpoint was. And the thought is, how are we going to do this? Because there's no redundancy in our system. And it was kind of a marvel for me as I watched primarily our younger leaders, our nurses, doctors, social workers, led by, we have our CEO is a nurse named Barry Bach. And what they did was we turned the program upside down. We converted our respite program, the McGinnis House, into a COVID unit on one floor. So we'd have 50 some beds to take care of people with COVID positivity. And then we started screening everybody going into the shelters because we didn't want anyone to go into a 500 or 600 or bed shelter with COVID because it would spread like wildfire. We were hoodwinked, thinking that the screen was an effective thing to do. And it turned out, to make a very long story short, most of the COVID we were seeing in the shelters was the people were asymptomatic at the time of the testing. And when we did universal testing, we found through all of our large shelters, 30 to 40% of the people were positive. And so that only created more of its own work. We had to find places, we go in and screen 500 people one day, and when the results came back the next day, we'd have 148 people we had to go get somewhere else, get out of the shelter and bring somewhere else. So we had a whole network that I could elaborate on, but the staff was just remarkable. We had tents for isolation and quarantining. We ended up having 500 beds of a shelter, medical shelter inside the Boston Convention Center, right alongside a 500-bed hospital, sort of a pop-up hospital that Mass General Brigham ran. And so it was a real experience. So all through at the end of March until just early mid-June, I guess, we were just deluged. And ever since mid-June, I think mostly it has gone down. We're seeing very little in the shelters now. And life is going back to normal with the thought that, oh no, the second wave is coming. And I'm sure Seattle, like Boston, is starting to see the little rise that is really scary.
Absolutely. It's pretty incredible to hear how you all rallied and really responded to the needs of this crisis that is still so new. We're still learning so much about. Tracy, you have seen challenges in countries around the world. The fact that homelessness exists here in Boston, in Seattle, in America, at the rate that it does and at the crisis it does is pretty astonishing. Can you share a story from your time out there that really stuck with you?
Well, I have one in particular. I got pretty close to one guy. I mean, I should say, I think this is unbelievably shameful. It really, just the existence of homelessness in the world's richest country is just absurd. And the dodging and weaving that's been done to try to get around fixing this is also appalling to me. But anyway, this fellow I met was one of these guys. He was in some ways a classic rough sleeper. He, an enormously talented person, natively talented and big-hearted, and with a childhood that is really typical of so many of the people that are Jim's patients, which is to say, if it had just been normally bad, it would have been fine. But it was appalling. I mean, really appalling. But and he did a lot of time in prison. I won't go into all that. but the guy he was a great, big, powerful man, and pretty sweet, though he knew how to fight. And he became kind of the kingpin of all of the rough sleepers in Jim's group. He defended the weak. He defended the people everybody else wanted to pick on. He wouldn't let them do it. And he some of this we didn't learn until after he died on the street, which is enough to make you really upset and maybe a little angry. He shouldn't have died on the street. He died at 50. But we learned afterwards there was this outpouring from the women. Now, and women who are sleeping outside are the most vulnerable people in the city. I mean, it's just, and Jim has always told me that their stories, and I've learned that their stories usually are the worst. And he protected women. He wasn't looking for romance or anything like that. He just protected them. And they called him the night watchman. We didn't know this. All this stuff came afterward. He's not suffering anymore because he did suffer. But that was the most powerful experience in some ways for me. But there's so many others. There's so many wonderful people.
Right.
I tell you what, do you have time for one quick story?
Go for it.
This guy, one of my favorites. He used to be a heroin addict, and he got cured of that by main force, but also with a lot of help from Jim's wife, who was at the time a physician's assistant. But he's sort of a sidekick of Jim's. On Friday mornings, he'll go out and see what's going on before Jim does his street rounds. But he told me a wonderful story about the days when he used to panhandle. They call it stemming in Boston, by Fenway Park where the Red Sox play. And he had a wheelchair for a prop, which he didn't need. Actually, he had several in case one got stolen. And he'd sit there, and he said one day these two elderly women came up to him and they said, "We've been saving all winter for you, and we want you to have this." And he said, "They gave me $1,300 in cash." And then he sort of paused telling the story. He said, "I guess they were kind of disappointed." And I said, "Why, John? They didn't know that you didn't need the wheelchair." And he said, "They did when I got up and ran." There's this wonderful rascality. I've envied Jim his practice. I mean, he's the only doctor I know who gets to sit routinely and examine one of his patients while the guy explains to him how you rob banks and that sort of thing. So it's
amazing, right?
A lot of color to it, the world, and I don't mean to say that it's just entertainment, because it's a very painful thing, all in all. And I mean, once you get a little sense, I mean, there's a way in which your whole view of the world changes, of a cityscape changes. You see some maintenance man early in the morning washing out a doorway, and with a bucket of water, someone was sleeping there last night. You see, really horrible cold winter weather as we get in Boston, and you might have once thought about fishermen who might be out at sea, but instead now you think about some of the people who are, somehow or other managing to get through that. And and these people, you notice as at a street team meeting that these names start coming at you all over the place. You think, who are they talking about? After about a week, they start to get into your head. And one of the team said this. I mean, and then you have a really hard time getting them out of there for a little rest, which is, I suppose, a problem. But it's really compelling work. And I'll stop.
I think that's a really such a great point, right? That they're people like all of us. Okay, they just happen to be in a really, really terrible, traumatic situation. I love what you just said. There are these stories that stick with you. Jim, tell me about a story that sticks with you and really motivates you each and every day to do this work.
I was sitting here as I was just listening and realizing why Tracy is the storyteller here. But I can tell you, I mean, there's a million, but I would tell you one that I was just thinking about when Tracy was talking. So there was a woman that, lived on the streets for years. We got to know her. It took us a long time to get to know her at nighttime on the van, offering her stuff. When we finally got to know her, she, we got her in a little bit, tried to get her housing. She kept drinking and she got hepatitis C, and eventually her liver started to fail. And we had her in our McGinnis house, where the liver surgeon said you could stay for 6 months. If we could show 6 months of residential stability, meaning could we keep her in McGinnis house stable for 6 months, and that she could show them that she could stay sober, then they would consider giving her a liver transplant, which would save her life, basically. And she did it. This woman, her name was Constance, and she did it all, much to our surprise. And she was delightful. She loved it. And the story that will stick with me forever is she was getting near the end of the 6 months and doing successful. So we're hoping she's going to go to surgery. And she called me one Sunday when I was there and asked me if I would take her picture for her. And up until then, we were really nervous, as Tracy can tell you. It's, you don't want to be a voyeur or, exploit people in any way at all. So we tend to not do pictures and not do stuff. We did mostly back then. And so she got all dressed up. I'd only seen her in rags. She called herself a bag lady. And she got all dressed up and had nice shoes on. Her hair was in a bun, lipstick, eyeshadow, all this stuff. And she had gone outside McGinnis house and gotten some fresh flowers to put in a styrofoam coffee cup on her bedside table, which I remember distinctly. And I took the picture and I thought, maybe I have to, she's worried about dying. She's having a big surgery coming up. So I thought maybe I should sit down and talk to her about death and dying. And, and I felt close enough to her at that point that I could do that. And when I started to do that, she just laughed me off. And she said, look, I've been out on the streets for 30 years. You think I'm afraid of death? I live with it every day. And she would point out, in fact, I would cherish death sometimes. But then she went on to say that, look, I have 2 daughters. I last saw them when one was 3 and one was 5. And she said that was 27 years ago. And she said, I wanted to have just one picture where I could be respectable. So if they should ever go looking for their mother, there'd be something to document that her mother was somebody. And I was, it took my breath away when I realized it was all about leaving something for someone else. And so that was the first time I ever realized that some people really want a picture of themselves that they can cherish. And as I've told Tracy before, the next day I came into McGinnis house. I brought the picture back to her that afternoon, and I came back the next day, and there were 22 people who asked me to take their portrait. And we now have in our McGinnis house portraits of people around, because it's something about they're passing through this way and they are somebody and what they're looking for. You should see how they respond to Tracy. At first we were nervous that, what do you do? Some very famous person's going to be hanging out, and it took them about, I would guess, 30 minutes to just see Tracy as one of everybody, but they want to tell their stories. They feel it's a story that can help and teach somebody else. So those stories let you know that, kind of like we're all broken, and they really want to talk about their brokenness and how that might help heal someone else. It's really interesting.
Wow, that just gives me chills. What an amazing opportunity. Well, thank you both so much for sharing some of these stories. We're gonna get some questions from our audience. But first we're gonna take a little break and hear from the staff at Healthpoint. Healthpoint is sponsoring tonight's event as part of the launch of their Healthier Together campaign. And tonight we're going to hear from some of those incredible staff members in their Healthier Together video. When we come back, we'll have the opportunity to take questions from the audience. So please put your questions in the Ask the Question box.
I love Healthpoint's values. They're my values as well. For a lot of our patients, just being able to have that space where they can feel heard does a lot for healing and does a lot for feeling safe in order to come back to access care.
When I've been other places, they didn't have everything in one building like this does. It's a one-stop place for me. I like that I can go to acupuncture here, OMT here, counseling here, and the pharmacies here, and the dentists are here. Being with a walker and disabled just makes my life simpler. I feel everybody's concerned about my well-being.
I have this whole agenda in my mind about the first visit, and I want to take a really thorough medical history, and I want to make sure we do X, Y, and Z labs. And I just sort of put that aside for a second. And I say, my only goal in this visit is to make this family feel comfortable enough that they feel like this is a place they can come back to. I think I ask a lot of questions about what people's lives were like before I met them, and sort of recognize that there's a whole history that has brought them to where they are today.
When I was 12, I was a patient of Healthpoint Kent. I think we all have a personal reason why we're here working for Healthpoint. We cared for our patients so much. Once they step right in through the clinic doors, we like for them to know that they're at the right place.
It is amazing that we can provide all these different services under one roof. We are always trying to advocate for our patients to give them great health care, but also be a community partner with them, a friend, someone that they can trust.
I like to say that everyone has an invisible sign that says, make me feel important, and the ability to see that sign on people, on everyone that walks through our doors.
A lot of times, our patients have told us they feel invisible when they go outside of Healthpoint because they feel like they can't speak English. That's the barrier that most people just ignore. And it's like, we're not going to do that here. Pick a language. Look at which language do you speak? We got it. I'm kind of bubbly. I laugh a lot. So that's my personal challenge. If they come in upset, by the time you leave, I'm going to make you smile. I want you to feel like we know who you are.
Our patients trust all of our staff here, and the little touches they get throughout the day, from the front office to the medical assistants to a referral coordinator. I mean, we've even had a patient who trusted our front office so much he would bring his mail in to have them help him read it.
We work here because we believe in what we're doing. We work here because we want to provide great health care, a place where patients can come in a safe environment.
When I came to the US, there's a lot that we went through because we were undocumented, and having to take care of my siblings at such a small age, and my client service representative role helps me help people a lot because they can understand what it's like to have $0, to not have a penny in your pocket, and not know where to go. And it's hard, but it's not impossible. I was down once, and there was a hand that was reached out to me, and they lifted me up. That hand came from Healthpoint.
Oh, I just love that video and love the work that Healthpoint is doing. You know, I work on issues related to homelessness and poverty every day and have the privilege of working with hundreds of nonprofits across the King County region. But the important work that Healthpoint is doing is one organization that continues to inspire me. I love the scale that they have clinics all across King County. I love that they have responded to COVID, not only by making sure that their patients have access to healthcare and COVID testing, but also that they're providing essential needs like food and other basics. I love that Healthpoint can provide care in over 70 languages. 70, that's incredible. Imagine how scary it could be to go to a doctor in a new country when you don't speak the language. That's just not an issue with Healthpoint. As you just saw in this video, every person in the organization is deeply committed to their mission to break down barriers so that everyone can get access to high quality healthcare when and where they need it. And that includes our neighbors experiencing homelessness. I hope you will join me in supporting this work and make a donation to Healthpoint. We've made it really easy by providing a link on the event page, or you can visit healthpointchc.org for more information. It's an incredible organization, and I do hope you can support us. All right, now it's the good stuff. Time for questions. So Tracy and Jim, why do you suppose that there are people who are experiencing homelessness who choose not to go to shelter? Here in Seattle and King County, most of our shelters are at capacity. So most people aren't choosing that, but certainly given the cold weather in Boston and the dangers of being on the street, why do you see people make those choices?
To set the backdrop a little bit, we don't have a right to shelter in Boston, but in 36 years, we've had 3 mayors. We have very slow mayoral turnover, which has been a blessing. But all 3 mayors have been committed to making sure that every adult who wants a shelter bed or a mat or a place in a shelter would have one. So, and all of our shelters, except for the veteran shelter, are what they call wet shelters. So you don't have to be sober to come in, can't use or drink when you're inside. So for the most part, there is a bed for anyone who really wants one. Mm-hmm. So then that sort of, in Boston anyway, that defines the people who don't go in tend to be, as Tracy pointed out, a really sort of a very distinct subgroup of the homeless population. And from our perspective, those who probably have the highest burden of co-occurring medical and psychiatric and other stuff going on. But the reasons are plentiful. Some people just don't want to be in a 500-bed shelter where there's too many people. There are many people who suffer from all sorts of thought disorders and paranoia. And when they go into the shelter, they're afraid that's the CIA or the FBI is going to be watching them. Other people, very frankly, just, may not be able to go that long a time without having a substance. They may, because when you go into the shelters, you can go in and you can't leave until the morning, or if you leave, you're out for the night. So that requires a commitment to be there for that time. And then the other thing that's kind of interesting and sort of sad is that none of the shelters, because of all sorts of liability and safety issues, will allow couples to stay together. So you have to split up at nighttime. And so if you really need to be together, and that often describes the really most difficult relationships, they stay together outside. So that tends to be the most of the people that are out there.
Just to add one story you told me, Jim, about the patient who you had gotten to know pretty well, and he wouldn't go in, and it was a really cold night, and you tried to talk him into it, and you said, "Look, I'm afraid you're going to freeze to death out here." And he said he just couldn't go, and you said, "Why?" And he said, "Because when I'm out here, I know that the voices I hear are mine. When I'm in the shelter, I can't tell whose voices they are."
Yeah.
Powerful. We've got a question here from Stephanie, who says, do each of you see a solution to homelessness? Or do you think that we'll need to continue expanding services for folks who are unsheltered?
Tracy, I always leave that question to you, but we talk about this all the time and try to run away from it. But and I don't mean to be making light of it. I think it is the question, and I think as I've looked over time, at least from my perspective, we've had all sorts of ideas about what the solutions might be, but we've never tried any of them to the scale that is necessary to fix the problem. And I've come to think it's just a very horrible tragedy of our society, but it's going to take so many different sectors to fix this and so we have to fix the schools, you have to fix the jails, or we have to obviously now address the racism, the poverty, all the things that homelessness is the end result of. We need to be fixed. So I've lost my ability to think of a simple solution. It's obvious we need housing. You can't solve it unless you get some housing. So we need to scale up housing to a huge degree. But I think you in Seattle would know the same problem we run into in Boston, that it's so expensive. First of all, there's no housing available. And the housing that is available is so expensive, nobody who's got very low income can afford it. So we're sort of creating two different classes, and we haven't been able to house that very low class. And it's so expensive, nobody's willing to put up all that money. But let me stop there. Tracy probably has a much more.
It's going to take. I guess the big thing that I'd like to say is that housing alone is absolutely necessary, but it's not going to be enough. We almost start to think that somehow or other homelessness is a human attribute instead of a condition that people shouldn't be in. But there's a reason why. There are many different reasons, a huge number of reasons why people are homeless. But we shouldn't assume that they have no other problems besides being homeless. Besides not having a roof over their heads. We certainly have plenty. Those of us who are housed, and a simple one-size-fits-all solution is simply not going to work. And I think everybody who really tries to do this stuff knows that. We do need a huge amount of housing, just an enormous investment in housing. And it ought to be decent housing. That's the other problem is there is no housing in Boston that isn't really expensive, except for the stuff that I don't want to get all into this, but there's a wonderful study, I guess, that's been done elsewhere, but in Boston, where you have the life expectancy by T stops, by our transit stops, subway stops, and you drop 30 years if you go from a very wealthy neighborhood to one of the poorest neighborhood in Boston. So the kind of housing is going to matter. So it's a huge, but it is also symptomatic. I mean, if you fix the other things that we really need to fix, if you could fix child abuse and foster care and all the other things that are involved with that, you go a long way toward a start anyway, seems to me.
Definitely. I think it is, Dr. O'Connell, you said we know many of the solutions that do work, but we haven't done them at scale. And I think that so often that really does become a big part of the crisis. We've got a question here from Hannah, and I think this builds in some of the stuff Tracy was just talking about. What have you come to understand about why healthcare access for the most vulnerable is important for everyone in a community?
Jim better answer
that. I can give a simple. I think it's compellingly obvious that, we're a community. We have to take care of everybody in our community, and those who are suffering are going to suffer. But COVID was a great example of why the health of your poorest and most vulnerable people is really important to the health of the city. So we were, when we got, and I think you in Seattle, it was almost the same, maybe not quite. So when 40% of everybody who was sleeping in a shelter got COVID, and they were sleeping in the shelter because they had no other place to go. So we were asking people to go into this place to sleep because they have no other place to go. And then we gave them COVID. And then the next day they're walking out around the city passing COVID to everybody else. So, an infectious or communicable disease shows us why we have to all be in this together. And that's like just the most gross, simple way of looking at it. And then I think when you look at it from the other end, we take care of people who have, the leading cause of death, for example, in this rough sleeper group that we're talking about is actually cancer. It's not like the things you might expect, like hypothermia and assaults and stuff. But, we always take care of people with cancer. That's what we do. You don't want somebody dying alone of, advanced cancer for which they got no care. So it's in one hand, it's the obvious thing that you can see with COVID, but in the more subtle things that you will see at the end of life is where you start to see how unfair everything is. And the thought that we can live with having people go through that and then die alone is just, I think, intolerable for most of us. It's not what we see as the village or the city. We're supposed to take care of people. I often wondered, we talk about this. I grew up in a little town. I'm actually in Newport now, or my hometown. And I remember we had one homeless guy when we were growing up, and he was what we called shell-shocked from World War II. And he used to go down the street and turn around and yell at the thing. And if he ever fell down on the sidewalk, everybody ran to help him, to just get him up. And then somehow now I live in a city where we'll step over hundreds of people to get to work, not even notice it. So there's something in the evolution of a society or a city where you go from everybody watches out for everybody to where we have to turn a blind eye. And I think as a society, we have to really look ourselves in the eye and figure out what's going on there.
I love that. I think that's right on. We've got another question here. You've both talked about the incredible nurses and doctors and social workers that have such a passion and drive for this critical work. And we know that they've all been working, they're always working tirelessly. And during the COVID pandemic, it's been even worse. What do you think has helped these providers avoid burnout so far and stay so committed to the mission?
I'm looking for outside help here.
Well,
Someone said it's a character flaw.
But most of the people I've met who are doing this work, for them, it's a vocation, really. I mean, it isn't just a job. It's a terrific job, and they're very good at it. The people I know there. But I suspect it's, it's rewarding in itself in some way. I mean, it's not to say that people don't get tired and utterly exhausted and absolutely need breaks from it, but it's not the kind of thing that it's somehow self-renewing. It's not. They're not. I'll tell you one thing that's really true about it is that this kind of medicine, which is completely upside down and inverts the modern form of the quasi-industrialization of medicine that's going on, where you had you're working to a time clock. There's still get paid 3 times more than your counterparts in Europe do, but you're working. You got to see this patient. You got 15 minutes, and or maybe you got 20 if you're really lucky, or even half an hour. In this practice, that just doesn't work, and Jim can tell you, again and again, if you don't spend the time with the patients, they're not going to come back, and so you get to do what you sort of dream to do as a student, as someone who was thinking of becoming a nurse or a doctor or a physician's assistant, or you name it. You get to spend time with these people. You get to know them, and you get to stay with them, because that's another big feature of this kind of medicine. In fact, in some ways, it's really superior to what many of us get. I mean, I happen to have a really wonderful country doctor, family physician, but a lot of people don't get that anymore. And I remember when my best friend was dying, and he said something really poignant to me, which was that one of the problems with modern medicine is that when doctors think they can't fix you anymore, they kind of lose interest in you, and it's at almost the worst time. And I do think that the principle that Jim learned from Barbara McInnes, this kind of lovely line of, we're going to stand with our patients in the dark. We need to. Is that the right phrase, Jim? Was that the phrase?
Yeah, it's quite, yes.
Right.
I mean, I think that's it almost answers itself. If you, people are lucky when they get to have a job, they get to do a job they really love.
Absolutely. We know that the racial disparities that exist in homelessness are continuing to grow, and we've seen that there's incredible racial disparities when it comes to COVID-19. Why do you think that there are those disparities, and what do you think we can do about them?
This is worrisome to me, because Boston is perhaps not characteristic. It's not that there are enormous racial disparities in Boston, but for instance, among the rough sleepers, really 3/4 of them are white. They're not black. And actually, if you look at the proportions if you look at what we think are the numbers in Boston, it pretty much follows the general population racially, ethnically. That isn't to say that that's accurate. I know that there must be tons of people who are uncounted. An African-American member of Jim's board who used to be homeless, wonderful guy, told me that, in his experience, homelessness was very different. His people he knew, and he didn't go to shelters, and they didn't live out in the street. They went to their mother's house, or an old girlfriend's house, or a friend's house. had other ways of coping, and those ways make them uncountable. At least, so I don't think we really know. I do know. I mean, I'm sure that it's, and in Boston we do know. I think, Jim, isn't this correct, that for families that are homeless, it are almost entirely African American and Hispanic, and they're almost entirely single parent families.
Yeah.
I think.
Jim, what about you? What do you see from the healthcare perspective?
I would second everything that Tracy's saying, and we are, a couple things. One is we've learned that in the whole healthcare system, let alone anything else, there's such implicit bias and racial things. And we look at our program and realize that as we look at the doctors, for example, as Tracy said in the beginning, we've had a very hard time attracting doctors of color. And we attribute that to our inability to make it an environment that will bring people in. And then you say, how do you create that? So I think it's a real issue facing not only us as a thing, but the whole healthcare system. I don't know how I read about Healthpoint, and it looks like it's amazingly diverse, and I would love to learn how that has happened. But when we look at our system here in Boston, we have a really pretty good healthcare system, but we're having a hard time making sure there's, even women. It's been, something we've been trying to work on. Now, that said, every time we do studies, and I would love someone to look further into this, is something, the journey to homelessness is a very complicated one. And people get there very different way. And for some reason on the streets, it looks more like you see more white men and women on the street than you would expect, and less of the African. And then as we look at it, there's something about the journey where it's almost that the white people who hit the streets have burned every bridge they have, whereas the folks in other communities take better care of themselves. So they're doing just what Tracy said. They've got other options to go to. But we see so many people who, were married, started drinking, lost their job, they got kicked out of the house, and they go straight to the street because they have lost everything. But that story is not typical of someone who's, has a family and a network, even though they may be impoverished, they've still got a network. So that's
right. It's that network.
Right. And that interaction is really fascinating to me, and I don't know how to cope with it. But we know we have to fix, that homelessness, I think at its root is a problem of racism and a problem of poverty, and it's very concentric circles.
Absolutely. As we close out our night, there are so many challenges facing our communities and our nation right now. What's something that gives each of you hope and keeps you committed during these challenging times?
I thought about this. The story I tell myself is that when I get up in the morning, I used to read the New York Times, in the paper version. Now I read it in the electronic one, and and usually the usual impression in the morning is that violence and chaos and various kinds of stupidity rule the world, cruel stupidity. But to know, I've now seen a few organizations, including this one, that seem to me to be putting up a fight, a competent one. And even though I don't suppose the data suggests that they will ultimately be victorious, just the fact that they're doing it well, makes me feel better.
Absolutely. Jim, what about you?
So I think about this one a lot, and we've talked about it, but it is without a doubt, it's the privilege of getting to be invited into somebody else's life who's lived completely a different circumstance than we have. And I guess the best thing, because I would expect everybody would burn out, but we see very little burnout in our staff. We see burnout over, temporarily, but usually there's a team that gets them up and they can, get through it. And in the old days, we used to see people burn out when they got involved with homeless people and started to take care of them. You get so enraged that this person I'm taking care of has got no chance against a system and then you rage against the system and you want to change everything. And then you come to the realization that I'm a social worker, I'm a nurse, or I'm a doctor, and we can't really change homelessness, but we can take care of the person in front of us and get to know them. And I think the real realization for me came when we would, one of the mandates we had was to make sure we stayed in part of the hospitals. We couldn't stay completely in the community because the homeless people, when they got sick, felt they could always go to the hospital. They want to make sure their doctors and nurses are there. So there's nothing quite like visiting someone you followed for a long time on the street who gets very sick and they're now in the hospital, scared to death, and you go in as their doctor and talk to them. There's something about that experience that you realize, wow, we're taking care of a bunch of people who really appreciate that we're there. And I think that, the selfishness of realizing it's their appreciation that keeps us going is not to be diminished. And, it makes it helps me get to sleep at nighttime to know that we're going to stick with people in that way.
Every so often, do I have a second? I mean, every so often you see something that makes you think, okay, this is the way the world could be. I just remember one of Jim's patients, African-American woman, just a wonderfully wacky woman, was dying of cancer. And she was doing it in a part of Mass General, a very elegant part of Mass General, the very same floor, I believe, where Teddy Kennedy spent a lot of his last days. And I thought, well, okay, this is just symbolic. This is perhaps superficial, but it is a little suggestion of the way things could be.
The way things could be. Well, I look forward to continuing to dream about that time and work toward that time where everyone has a home in our community and everyone has the healthcare that they need. Jim and Tracy, you have been incredible. Thank you so much for joining us for this conversation and the incredible work you're doing. We cannot wait to read the book when it comes out.
Me too.
And look forward to it.
And Lauren, thank you for all this, by the way. Thank you for being so kind to us. And Lisa, thank you. It's been such a pleasure to learn all about Healthpoint.
Really good fun. I wish we could have come there.
We'll get you out here. We're now going to hear from Healthpoint CEO, Lisa Yohalam. Thank you so much for joining us, Lisa.
Thank you, Lauren. Thank you, everyone, for joining us tonight. And thank you so much, Tracy and Jim. Thank you for sharing your work, your passion, and your joy. I, too, look forward to reading the book. Thank you, Lauren, for being our moderator tonight and for being a friend to Healthpoint. And thank you to Town Hall and to the Healthpoint events team for making this possible. At Healthpoint, I think we believe that everyone deserves great care. And I think the stories we heard tonight really highlight that sentiment. With all that's happened this year, we've been so clearly reminded that our health is connected to and dependent on the health of others. As we look toward the end of the year and into 2021, we know our community's need for accessible, compassionate healthcare will only increase. We hope you will join us in our work to respond to COVID and to create a healthy community for everyone. And if you are just learning about Healthpoint tonight, please go to our website to learn more, healthpointchc.org. Everyone out there, be well, stay safe, and have a great evening. Thank you.